But we're going to keep talking about the next steps for the reopening in the country and COVID-19. And we're going to do that with Dr. Uche Blackstock, CEO of Advancing Health Equity and Yahoo News medical contributor. It's good to see you again, Doctor. Thank you for joining us. As we were coming into the stream at 3 o'clock, there's news out of Pennsylvania. They're going to start rescinding some of the more restrictive measures to protect the public. Is this the time to start easing up? We're doing it in New York, too.
Well, thank you so much for having me back. I don't think this is the right time. While, things are looking optimistically in terms of overall cases and the vaccination rollout, the concern is that there are variants that are very much here, and we're seeing spikes in cases throughout Europe. The same could happen here, especially if we lift mask mandates and indoor gathering restrictions. Now is not the time.
Dr. Blackstock, it's Shauna. You're saying that now's not the time. I think what people are wondering is, when is the right time to do this? I guess what does the data need to be telling us? At what point in this pandemic do we need to be at? What do you say to all that?
That's such a great question. And I think what it's going to be is actually several indicators. It's going to be a decrease in cases over a certain period of time to a significant level. We still are at a significant number of cases every day in this country, so still very high, but also looking at the percentage of the population that has been fully immunized will also be important. Now, of course, we are not going to wait till we reach herd immunity at 80-90% before we lift restrictions, but I think a combination of seeing cases coming down for a certain period of time, plus a critical percentage of the population being vaccinated, are good indicators for deciding when to lift restrictions.
Is it appropriate, or are we asking the question incorrectly? We look at Florida, had much easier restrictions in some places like New York. And we asked doctors this question last week. The outcomes seem to be the same. So did they overdo it in states like New York with the very restrictive measures that were taken?
No, I think that there's probably no easy answer to that. I think that it's better to be cautious. And yes, the restrictive measures probably undoubtedly save lives. We have the evidence that mask mandates work, that restricting indoor gathering and indoor dining, it actually works. And so there are probably other factors at play. It could be variants, it could be population density, and other factors that may have resulted in the fact that we're seeing similar number of cases despite prevention measures put in place. I don't think that's a reason why we should discourage following these prevention measures, because we know evidence-wise that they work, and we probably could have had even more deaths in certain areas if those restrictive measures had not been followed.
Dr. Blackstock, a critical question that so many people are asking across the nation is just what we need to do in order to get more kids back in the classroom. There was a study out over the weekend suggesting that 3 feet, not 6 feet, is sufficient when it comes to having students in school. I'm curious just if you saw that study and what your reaction was to this, and how big of a step it could potentially be in order to get kids back into schools.
Yes, I saw that study. It was out of Massachusetts, and essentially showing that there was the same degree of transmission in schools that followed a 6 feet rule, and in schools that had a 3 feet rule. And I think by now we have enough data out there that shows that we can reopen schools if we put prevention measures in place. So we know that masking works, smaller cohorts, testing, and then of course, prioritizing our staff and teachers. They should be vaccinated as soon as possible. They need to get back to the essential work of educating our children. My children have been back in school 5-day in person since September, mostly uneventfully. And I think that we owe it to our children, especially after a year, to get them back into the classroom as soon as possible.
Dr. Uche Blackstock, CEO of Advancing Health Equity and Yahoo News medical contributor, thank you for joining us here in the stream.